Hi, I'm Dr. Tish from Research Clinic with our Mid-Minute question for this week. And this is a good question. This is something we get asked quite frequently. So in regards to females, hormone replacement, what's best? Pellets, patches, creams, or injections? Which one works the best? I've answered these kind of questions before, and this is really what works best for you. Each one of those has its pros and cons for sure. Really, they have something. Pellets last for 4 months, so those are nice and convenient. It's set it kind of, and then you don't have to worry about it. Patches you can adjust, and creams, which are basically the same, you can adjust the dosage much more frequently. You have to apply it every day, though. And so that could be a benefit for some people or a huge drawback for others. Some people cannot stand having to do something every day. And so if they don't are consistent with it and miss a few days, then their levels are going to go up and down. And they will feel that way accordingly. They'll feel good and then bad. Shots are, again, a little bit more predictable. They require an injection, generally once a week, and they work very well. Now, each and every one of them, if you dissect them apart, has some really good qualities and some really bad qualities. And so really, when I'm talking to people, I really try and find out what they're comfortable with the most, how they want to proceed. And it's not uncommon for people to start one form of therapy and to switch to another, just to try something. A lot of times if someone's unsure about doing things, they may start with one of the lesser ones like the shots or the topicals and then advance to pellets. Many people already know, they've heard the tremendous success stories of pellet therapy and they want to go right to that. As far as overall, when you look at how women do, women tend to have a little bit less side effects with hormone pellets. They are a little bit more natural. Then if you look at next least side effects, it's probably going to be the topical preparations because those are, again, bioidentical, and then injections. Now, when I'm saying less side effects and comparing them, it's not like one is very bad and one's very good. They're very subtle. Some people who are, say, doing the shots never experience any side effects, and they love the way it is, and they just love the convenience of it, and vice versa. So I think sometimes we'll start with one form of therapy and switch. So there's no real perfect answer to that. I think really our main goal is optimizing the patient's levels to getting them feeling good, but really then finding which one is going to fit in their lifestyle. Some people are deathly afraid of injections. Well, we know that's not going to be an option for them. Others really have much too much stuff to do all the time. They're probably not going to be very compliant with the topical preparations, and maybe they're going to be more of a pellet person. So some people are very obsessive. They are really good with the creams. They're going to apply them consistently, and that's not a bad option. So it does sound like I'm talking in a circle, but it's very individualized. It's like saying which hamburger place is the best. It's all individual. But the goal is really for this is to get people feeling good. And so it's almost in a way, it doesn't matter how we get there, as long as we get there and there's no side effects. So I hope I clarified this murky subject a little bit. But anyway, that's my answer for that.